Hello everyone, my name is Courtney Cook. I'm a licensed board-certified genetic counselor, and I'm the founder of Cook Genetics Assessment and Testing, which is located in Effingham, Illinois. So this is our video series where we are talking about different types of cancers, and based on that cancer type, who should get genetic testing, or at least consider genetic testing and talk with a genetic counselor. So this is our third video in this series, and we're going to talk about colon cancer, colorectal cancer during this video. So again, there can be a lot of overlap of different cancers in families, and really our goal here is that if one of these videos jumps out to you because you're concerned about colon cancer in your family, you might have multiple cancers in your family, but if colon cancer is one of them, then this is a good video for you to see if there is a reason that you need to come get genetic testing. So we're going to talk about colon cancer, rectal cancer, colon polyps, things like that. So anytime that we say colon cancer or colorectal cancer, we're really just encompassing a lot of things here at once. So we'll go through this list and start at the top, and then at the very end we'll talk about ways to contact us. So our first indication for someone to think about having genetic testing with a genetic counselor is somebody that has had colon cancer diagnosed at age 49 or younger. So if you are a man or a woman and you have had colon cancer and you are 49 or younger whenever you are diagnosed, then we recommend that you have genetic counseling and possibly genetic testing. That's our age cutoff for considering a colon cancer to be young is 49. So we don't count 50. So if you are 50 whenever you're diagnosed, you don't really fit for this criteria. You got to be 49 or younger, but we'll get to the other ones next. So other types or other family history, personal history combinations to fit for colon cancer genetics would be if one person was diagnosed with colon cancer at any age, and then they have another cancer that's associated with something that we call Lynch syndrome. So Lynch syndrome is a genetic condition that we test for that can really increase the risk of lots of different cancers. So mostly GI cancers, but there are some skin cancers and maybe even some brain cancers as well. So I'm going to give you the list of Lynch syndrome associated cancers right now, and then we'll be able to reference these for the rest of these criteria. So cancers associated with Lynch syndrome, here we go. Colon cancer, uterine cancer, stomach cancer, ovarian cancer, pancreatic cancer, bladder cancer, biliary tract cancer, urothelial cancer, small intestine cancer, brain cancer like glioblastoma, and then sebaceous cell adenomas or carcinomas. So sebaceous cells are like the oil glands in your skin. So if you've had a cancer of those oil glands, then that would be a sebaceous cell carcinoma. So those are all the cancers that are associated with Lynch syndrome. So a lot of the criteria for colon cancer genetics kind of surrounds Lynch syndrome. So whenever we talked about our first criteria, just saying, well, if you're 49 or younger, regardless of what's going on in your family, if you were 49 or younger with colon cancer, you should think about having genetic counseling and maybe genetic testing. That one was pretty straightforward. But the rest of these were kind of combining personal history, family history, and a lot of them are associated with some of those Lynch-related cancers. So our second criteria, again, was colon cancer, diagnosed at any age, and then having another one of those Lynch-associated cancers in the same person. So if you are a woman who had colon cancer at age 55, and then at age 65, you had uterine cancer. You've had two different Lynch-associated cancers, one of which was colon, then that's pretty much a home run that we should talk about doing some genetic testing there. Okay. Now our third indication is if you have had colon cancer yourself, and then you have a first-degree relative or a second-degree relative who has had one of those Lynch-associated cancers, and they have to be at least 49 years old or younger whenever they were diagnosed. So we'll break this down a little bit more. So remember, your first degree relatives are your parents, your siblings, and your children. Your second degree relatives is like one step out from them. So your grandparents, your aunts and uncles, your grandchildren, your nieces and nephews. So if you were diagnosed with colon cancer at any age, and then one of your close relatives, first degree or second degree, were diagnosed with any one of those Lynch syndrome cancers, they had to be at least 49 or younger whenever they were diagnosed. So for example, you have colon cancer at age 60, and then your sister just got diagnosed with uterine cancer at age 45. That would be a good reason for you guys to consider undergoing genetic testing. Okay. Now, our next criteria would be branching out a little bit more into the family. So if you have had colon cancer yourself, regardless of age, and then you have two first degree relatives or second degree relatives on the same side of the family, so either both on mom's side or both on dad's side, who have also had Lynch syndrome associated cancers at any age. So you've got colon cancer, and then say on your dad's side of the family, maybe dad had bladder cancer and an aunt had a brain tumor. So that's multiple people that have all had Lynch associated cancers that all happen to be on the same side of the family. So 3 people with Lynch associated cancers, and you're the one that has colon cancer yourself, then you should consider coming and getting genetic counseling and possibly genetic testing. Our next one that we'll talk about is if you yourself have had more than 20 GI polyps. So if you've had a colonoscopy or an upper endoscopy, the scope that goes down through your mouth and checks out your stomach, and they've counted 20 or more polyps throughout your lifetime, then that's something that you should consider having genetic testing for. That might not be associated with Lynch syndrome. There are other genetic syndromes that we call polyposis syndromes. These are whenever the colon and the GI tract form lots and lots of polyps. So sometimes these polyps are precancerous. Sometimes they're more just annoying and they just keep growing. But anybody that's developing lots and lots of polyps during their lifetime, that's kind of a red flag that we should consider doing some genetic testing for them. So if you've had at least 20, some people have had hundreds, some people have had like an entire colon full of polyps, that's a really good reason for you to come get genetic testing. Another good reason to do genetic testing would be if you fall between having 11 and 19 polyps. So more than 10, less than 20. But then you also have had some other weird tumors going on, like a desmoid tumor. A desmoid tumor is a tumor that grows kind of in the connective tissue, like on your abdomen, for example. Or hepatoblastoma. This is a rare type of liver tumor. Or if you've had a thyroid cancer, or if you've had some problems with your eyes. So if you've had between 11 and 19 polyps, but then you've got one of these other features going on, then maybe genetic testing is something that you should consider, or at least come have a genetic counseling evaluation so we can try to tease out if that's what was going on in you. And so having lots of polyps, maybe not hundreds, but kind of in that mediocre range, and then other things going on, that's a good reason to think about testing. Other reasons, still sticking in that polyp side of things, would be if you have a more rare type of polyp. So most polyps, you might hear them called adenomas. So adenomas tend to be those precancerous type of polyps. So if you've had those type, we definitely are a little concerned, but if you've got one of these super rare types, then this should be something that you should consider coming and having genetic testing for. So the more rare types are what we call hamartomatous, juvenile type, and Peutz-Jeghers type. So these types of polyps are really just described by the pathologist. So whenever you go in and you have your colonoscopy and your doctor takes out a polyp, they send it to the pathology lab. And this is whenever they look at that polyp underneath a microscope and see what features it has. So then that's whenever the pathologist can say, oh yes, this is a hamartomatous polyp, or they say it's a juvenile type polyp. Now, on juvenile type, you don't have to be a juvenile yourself in order to have a juvenile type polyp. So juvenile means young, right? But that's not really what this is saying. People that are older age can have a juvenile type polyp. It's just how they describe the polyp based on the pathology report. And then remember that Peutz-Jeghers one. I'm going to spell this one for you because that's a mouthful. It's Peutz-Jeghers. Peutz-Jeghers. So Peutz-Jeghers syndrome is another genetic syndrome that we can test for. These polyps look very specific underneath the microscope. So if you've ever been told that you have a Peutz-Jeghers type polyp, come on in and we'll see if there's some genetic testing that we can do for Peutz-Jeghers syndrome. So those are different types of polyps that you might still consider coming and having a discussion about genetic counseling and genetic testing for. Now, next part here, I really want to get into more of the family history. So notice that I talked a lot here about you yourself having these diagnoses. So the next few things we'll talk about is if maybe you don't have a colon cancer or colon polyps yourself, but you got some stuff going on in your family. This part's for you. So if you have not had colon cancer yourself, but you had a first-degree relative who was diagnosed with colon cancer at age 49 or younger, and maybe they passed away or they're not interested in testing, then you can consider genetic counseling and genetic testing. So for example, say you are 40 years old and your dad was diagnosed with colon cancer whenever he was 48 and he has since passed away. Now maybe you are thinking about doing some genetic testing, so that would be a good indication for you to come in and have a counseling and testing appointment. Our next one is if you've not had any sort of colon cancer yourself, but you've got a first-degree relative who has had 2 different Lynch tumors themselves. So you've not had any colon cancer, but maybe your mom had colon cancer and uterine cancer. So that would be a good reason for you to get genetic testing, especially if mom is passed or is not interested in testing herself. Another reason would be that if you do not have cancer yourself, but you've got 2 relatives on the same side of the family, first-degree relatives or second-degree relatives, on the same side of the family that have a Lynch-associated cancer, and one had to have been diagnosed under the age of 50, so 49 or younger. So you've not had cancer, but say on your dad's side of the family, you had an aunt who was diagnosed with colon cancer at age 60, and your grandmother was diagnosed with uterine cancer at age 40. So we've got 2 different Lynch-associated cancers on that same side of the family, and one of them was diagnosed at age 49 or younger. Maybe those individuals passed away, so now you're the one who's interested in coming in and talking about genetic counseling, genetic testing. And then our last one here, you have not had colon cancer yourself, but you've got 3 relatives on the same side of the family who have had Lynch-related cancers at any age. So remember, these people all have to be related by blood. So 3 people on your dad's side, all diagnosed with Lynch-associated cancers, or 3 people on your mom's side. So those don't matter regardless of age. Let me go ahead and remind you of our Lynch-related cancers again here at the end. So if you had 3 of these people on the same side of the family with these cancers, then genetic testing could be indicated. Lynch-associated cancers: colon cancer, uterine cancer, stomach cancer, ovarian cancer, pancreatic cancer, bladder cancer, biliary tract cancer, urothelial cancer, small intestine cancer, brain cancers such as glioblastomas, and then those sebaceous cell cancers or adenomas, so those tumors of the oil glands in your skin. So if you've got 3 of those on one side of your family, then maybe you should come in and consider some genetic counseling and testing for Lynch syndrome, or maybe even other genetic testing as well. So those are the main ones whenever we're talking about personal history, family history of cancer. There are some other reasons that somebody might get referred to genetics based on like their tumor testing. So if somebody's been diagnosed with a colon cancer and there are certain features of that colon cancer that the pathologist finds, look a little different than they should, or maybe you had a tumor genomic test on your colon cancer to try to see if there were some targeted chemotherapies. And maybe your doctor is like, I wonder if this person was born with this change, or did it just happen to pop up in their tumor over time, because that's what cancer is. If any of your doctors have flagged anything like that for you on your colon cancer report, then that would be a reason for you to come to genetics, or reach out to us, tell us what you found on your pathology report or on your tumor testing report, and we can tell you if it's something that maybe you should get genetic testing with a genetic counselor for, to see if it's something you were born with. So we've got some personal history of colon cancer, we've got some personal history of colon polyps, we've got some combinations of personal history and family history here, and so there's lots of different ways that people with a history of colon cancer might meet criteria for genetic testing. So if any of that is in your family, please feel free to reach out to us. You can schedule appointments online on our website. But if you do have more questions, or want to learn more about us or more about some frequently asked questions, please do visit our website. It's www.cookgenetics.com. Or you can reach out to us on Facebook, Instagram, Twitter, or by email. My email is courtneycook@cookgenetics.com. And again, you can book appointments online and we can meet in person. So that was our hereditary colon cancer one, and we'll be back soon with some more videos. Thank you guys.